Greetings to all of you. I want to thank Dr. Pankaj for giving me this opportunity. I appreciate his enthusiasm and I greet each one of you. I'm so thrilled that so many of you have enrolled yourself in this volunteer course, and you will see that this is so satisfying and so fruitful for each of you. So, the need for palliative care across India is huge. Yes, globally, especially in low middle income countries and in India. If you see, even after almost 3+ decades of development of palliative care services in India, only 1 to 2% of patients who need palliative care actually get it. And palliative care is needed for everyone who has serious health related suffering, and the suffering can be of any form: physical, psychological, social, or spiritual. And that is why palliative care becomes everybody's business, and that's the very reason why you are here part of this course, and each of you can play a huge role in improving the quality of life of you patients and their families. I think the first thing to understand is palliative care is not just about death or end of life care. It is about living well and dying with dignity and supporting the patient and the family throughout this trajectory. It is about adding good quality life to the days while they are still living. So it is active care. It must be done. We are always thinking what more can be done. Never a point where we say nothing else can be done. And it is total care, reducing physical symptoms, maybe pain, vomiting, breathlessness, addressing psychological issues, supporting them in their spiritual pain, seeing how they can be also supported in their social life, family life. And hence, it has to be done by a multidisciplinary team where possible, and the role of doctors, nurses, counselors, chaplains, social workers, volunteers, and this list can actually keep enlarging based on the need of the patient. And that is why each of you can definitely contribute a significant something to the lives of these patients who are suffering. It is not only for cancer, it applies for patients with any non advanced chronic disease which is causing suffering of any form. It also needs to be ongoing. um, it has to be integrated along with the care of the patient, either by the family physicians, oncologists, their specialists, or palliative care specialists. And this care needs to come in every time when it is needed, not just when they're very sick and dying. And that's why identifying such patients very early on when they need, so that they don't get this good care, this holistic total care right at the end, but right from the beginning is very, very important. So we are looking at care for all who need, when they need, where they need. Some of them may prefer being at home, some of them want to be in hospital or a hospice, and not just the patient but also their families. And it is about giving hope. And I wish you all the very best as you do this course. I'm sure you will gain much. And please assure yourself you're stepping into a great area of need and you're engaging in this great palliative care movement across our country. And I see each of you as little candles going in to dispel the darkness in the lives of many who you will be involved with. Thank you very much and all the very best.